Okay. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Ariq Irfan. I am a med student from Unisula University, and today I will do my assessment 2 of class Emap. Today I will present about advancing diabetes care, the 2025 standard of care. The American Diabetes Associate, or ADA, unveils its updated guidelines setting the gold standard for diagnosis, management, and prevention. So the first slide is what is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. It occurs when your body either doesn't make enough insulin or can't effectively use the insulin it does make, leading to high blood sugar levels. The ADA Standards of Care Diabetes 2025 provides evidence-based guidelines for diabetes and prediabetes. It's the definitive resource for healthcare professionals, offering stage for diagnosis and treating youth and adults, for preventing or delaying type 2 diabetes, managing comorbidities like obesity, enhancing overall health outcomes. For key updates for 25, there's continuous glucose monitoring, setting for type 2 diabetes patients not on insulin, medication shortage, guidance on alternative action during unavailability, GLP, GLP-1 receptor agnosis beyond weight loss, amplifies benefits for heart and kidney health. And then there's common diabetes symptoms, recognize the symptoms of diabetes early can lead to timely diagnosis and better management. Be aware of these following common symptoms. There is increased thirst and frequent urination, unexplained weight loss, extreme hunger, increased fatigue, blurred vision, slow healing sores or frequent infections, numbness or tingling in the hands or feet. And then there's the clinical guideline. The first one is weight management. Continuing on pharmacotherapy, past weight loss, goals for sustained benefits across different type of diabetes, MASLD treatment, guidelines for metabolic dysfunction, associates steatotic liver disease, often linked to type 2 diabetes using specific agonists, and then type 1 diabetes screening, emphasize on antibody-based screening for those with family history or genetic risk, and update guidance for early diagnosis. And then gestan- gestational diabetes mellitus or GDM, new recommendation for screening, diagnosis, and postpartum management to reduce long-term risks for both mother and child. And then there's addressing lifestyle and special population, so the diabetes can reduce in oneself. The first one is recreational cannabis guides for type 1 diabetes and those at risk for diabetic ketoacidosis. And then pregnancy modifications, update on potentially harmful medication and care plan adjustment, and expanded nutrition, encouraging plant-based protein and fiber for nutrition, quality, and metabolic goals. And then here's other nutrition and hydration focus. You should water intake prioritize over nutrition and non-nutritive sweetness beverage. So drink clean water and nutritive sweeteners used in moderate and short-term reduce calories and carbonated intake. And then resistance training important for those on weight management, pharmacotherapy, and post-metabolic surgery. And then advanced management and screening. DKA or HHS management update guidelines for both outpatient and inpatient settings. And then social screening updates for fear, hypoglycemia, diabetes distress, and anxiety to support holistic care. older adult care, improved approach for diabetes care delivery, and preoperative GLP-1 usage, guidance on use in the preoperative care settings. And then practical tips for managing diabetes. The first one is monitor blood sugar regularly. Consistent monitoring helps you understand how food, activity, and medication affects your levels. And then embrace a balanced diet. Focus on whole food, lean proteins, and healthy fats. Limit processed food, sugary drinks, and excessive carbohydrates. And then stay active daily. Incorporate regular physical activity into your routine to improve insulin sensitivity and manage weight. And the last one is adhere to medication and appointment. Take prescribed medication as directed and attend all doctor's appointments for ongoing care and adjustment. And then for accessibility resource for those who have a hard time to care of their body and diabetes, there are some accessibility resource for the other provide various resources to ensure guidelines are accessible. The first one is online supplement available on supplement on to the January 25, which is on diabetes care, and the mobile app interactive tables and algorithm for iOS and Android for easy reference. Professional website, comprehensive slide deck, and webcast with continued education. And the last one, a bridge standard planned for release in spring 25 in clinical diabetes. Here are the reference and contents for more information on the standard current diabetes from the full publication. The material that I use from this uh, PowerPoint presentation is from the journal, diabetes journal, the first one, and then the rest uh, for completing the information that I need. Standard care app, and a professional website, and a main website, and press inquiries. That is all. Uh, Thank you for the time. I will close the presentation. Wassalamualaikum warahmatullahi wabarakatuh.